See, a lot of girls get depressed because whatever exercise they do, whatever diet they follow, the arm never comes down. Always it remains bulky, and in fact when they start doing exercise for the arms alone, it becomes more bulky also sometimes. What is this? How can you manage this? See, when you lose weight and doing exercise, body never responds to a particular area. Overall you lose weight, but it you can't ask the body to lose particular area fat alone. That's called stubborn fat. Sometimes the stubborn fat stays in the arm. Some people love handle, some people outer thigh, some people arms, some people it's a combination. So you get depressed because you completely drained your body, every area becomes slimmer, arms alone looks bulkier, and so you can't wear a sleeveless, and even with a sleeve it looks disproportionate. So how will you manage it? So this kind of a resistant fat only liposuction will help you, because it's not the a lot of people misinterpret liposuction for a weight loss procedure. Actually not. When they lose weight, particular area of the body alone is not responding to diet or exercise, then only liposuction will help. So normally the traditional arm liposuction, they tends to cover this area alone. Okay, this is the fat. Normally we train to remove it, but when we are getting in the practice, we see a lot of different requirement for the females, especially this area over the deltoid and the triceps areas. This bulk, girls don't like it, and this bulk for sure. So what we do nowadays is a circumferential, almost 360-degree arm contouring with a high definition. Some people they want to, especially the men and all, sometimes they ask for the grooves, the biceps grooves, the deltoid groove, all those grooves they ask for. So we, according to the patient's lifestyle and the need, we do a 360-degree contouring, then only you get a good results. But sometimes a lot of the gym trainers advise the females to go for the arm arm exercises by using a dumbbell and doing a muscle training for the arms, saying that females never develop a muscle. That's a concept. But the problem is, most of the females nowadays have a mild PCOS, the polycystic ovarian syndrome component. So because the polycystic ovarian syndrome component, what happens is testosterone also secretes in the body in the female. So they tends to work out a lot to reduce the arm, but because you also have testosterone, you bulk up the muscles, because female doesn't want to bulk up the muscle, they want a slender arm. So it bulks up the muscle. Then if you come for a liposuction, definitely we can't help you because muscle is bulky. Only we can remove the fat by liposuction. You have to understand that. So before you hit the gym for getting trained for the arm muscles, think twice and meet any plastic surgeon. They will guide you. Okay, you have to understand the reality. See, nobody wants to go for surgery for sure. Even I don't advise surgery as a first time when you're coming to meet me. But same time, you should not get misdirected, and then when you come back, that time we can't even help you with the bulky muscles. So understand this. So arm liposuction is a day care procedure. You come in the morning, same day evening you will be discharged. There will be a pressure garment. That pressure garment has to be worn for one month to 1.5 months, depending on the volume we remove. But first 2 days we put up plasters. Third day you come back, we give a pressure garment. There won't be much noticeable scars. So sometimes there will be a bruising in this area of the liposuction area. There will be bruising that becomes little dark pigment in few patients, especially the darker skin individual like us, and it takes some time to settle, sometimes even 2 to 3 months to settle that dark pigment. Sometimes it doesn't even settle. So these are all, so yes, definitely there is some side effects are there. We have to weigh the risk and the benefit. Accordingly we have to go for the procedure.